views and opinions expressed in this program are those of the participants and do not necessarily reflect the views of BronxNet or the program underwriters.
Okay, we're at 6:30. Good evening, everyone, and welcome. I hope everyone is doing well. My name is Adrienne Austin, your Deputy Chancellor for the Division of Community Empowerment, Partnerships, and Communications, and I will be your moderator for this virtual community meeting. Thank you for joining us for tonight's event, Returning to School, the latest guidance from our health experts. It is important that all of our families are able to participate tonight, and we are very grateful to the Spanish and Mandarin interpreters who are with us on a separate line. Thank you to Jessica Zito and Catalina Gomez, who are our Spanish interpreters. Thank you to Zhao Chun Yang and Yudi Wu, who are our Mandarin interpreters. And thank you to the Office of Sign Language Interpreting Services for providing American Sign Language at this meeting. We will now announce instructions in Spanish and Mandarin for attendees who may wish to dial into the interpretation lines at this time. Jessica, can you please provide the instructions in Spanish?
Yes, of course. Buenas tardes a todos. Para las personas que deseen escuchar el audio en español, marque el 888-475-4499. Es una llamada gratuita e ingrese el PIN 735-255-0102. Nuevamente, marque al 888-475-4499. E ingrese el PIN 735-255-0102. Si quieres escuchar audio en español, pero desea permanecer en esta sala de conferencias virtual Zoom para que pueda ver la reunión en su computadora, por favor, silencie su computadora y silencie el volumen en su computador y marque en su teléfono a la línea de conferencia en español. De nuevo, la línea de conferencia es 888-475-4499 e ingrese el PIN 735-255-0102 y el símbolo numeral. Gracias. Thank you, Adrienne.
Thank you, Jessica. Zhao Chun Yang, can you please provide the instructions in Mandarin?
Yes. 需要普通话翻译的家长，请拨打电话888-475-4499，并输入密码933-059-6663。我再重复一遍，需要普通话翻译的家长，请拨打电话888-475-4499，输入密码933-059-6663。在会议期间，请大家将手机和电脑保持静音状态。我再重复一遍，电话是888-475-4499，密码是933-059-6663。谢谢 ，Thank you.
Thank you. Once again, my name is Adrienne Austin, and I am your moderator for this evening. I'm really excited about tonight's event, Returning to School, the latest guidance from our health experts. We are joined by the Deputy Commissioner for Family and Child Health, Dr. Daniel Stevens from the New York City Department of Health and Mental Hygiene, who will provide us with information about COVID-19. It's going to give us a breakdown of the virus's impact on communities, and he's going to talk about the city's response to the pandemic. We will also hear about how the DOE's Division of School Climate and Wellness is incorporating health guidance into school reopening policy. We've received over 1,000 questions in advance of this meeting from families, and we've identified some commonly raised issues which we will try to address tonight. If your question does not get answered, or if you have additional questions, please check our website, which has the most up-to-date return to school information at www.schools.nyc.gov/school year 2021, or contact your child's school. Thank you for being here. It is now my honor, my privilege to introduce our New York City School Chancellor, Richard Carranza.
Thank you, Adrienne, and thank you to all of our families that are here this evening. It's good to be here this evening. As you all know, we always said health and safety is first when it comes to educating our students this school year. That's the bedrock of everything we do and how we know that we can safely reopen. It's important that we have these things in place. Number one, strict health and safety protocols. Two, clear thresholds for keeping students and staff in school buildings. And 3, meticulous testing and tracing. This school year will look like no other school year we've ever seen, and we are reinventing nearly every part of what it means to be an educator, to be a student, to be a staff member, or a parent in New York City's public schools. We've been in close contact with staff and unions since we began planning, and yesterday came to an important agreement about the start of the school year. So just to recap, school will start on Monday, September 21st for students. Staff will come to school earlier than that to get their classrooms ready, prepare for their classes, receive training and professional development, and practice all of the new safety protocols that will be in place to keep our students and staff safe. Let me take you for a moment through some dates for you. On Tuesday, September 8th, school staff will report to schools. Then on Wednesday, September 16th, Thursday, September 17th, and Friday, September 18th, teachers will orient students on the new models of learning. Now, we've spoken that since March, we've learned a lot about remote learning and what that takes. So this will be an opportunity for teachers to make contact with their students for the very first time, make sure that they're able to log on, make sure that they know where to find their assignments and resources. It'll also give our educators an opportunity to collaborate with each other. This will allow students, especially, to reconnect with their school community and learn about the health and safety procedures that will be in place. An important focus of this orientation period will be on social and emotional well-being of students, families, and staff. And it will also provide us an opportunity for deeper understanding of the ways that this unprecedented school year will work. Now, this is important because over the last 6 months, we've all experienced trauma because of COVID-19. We've either lost someone or had someone infected that's close to us in our families. I will just be very transparent and say that I've lost 8 family members to COVID-19 during this time period. So I know in real terms what that pain feels like and looks like, and that's trauma. So we're going to make sure that we're able to transition into this new school year with trauma-informed supports, but the social-emotional learning supports for all of our students, whether they're remote or in a blended learning environment. Then on Monday, September 21st, all schools will begin full-day teaching and learning. So what does that mean? That means that students in blended learning, which is the combination of in-person and remote, will begin to report to school buildings depending on their in-person schedule. Students in 100% remote learning will begin full-day learning as well on that day. This revised calendar will allow schools to take the time they need to thoroughly prepare for the start of an unprecedented school year. Beginning immediately, prioritized access to testing will be available to students, teachers, and all Department of Education school-based staff at the 34 sites across the city that are run by the City of New York. Beginning October 1st and recurring each month, it will be mandatory for schools to test a random sample of between 10 to 20% of their students participating in blended learning and on-site staff population. Families will be asked to sign a consent form at the start of the year for their child to participate at the random testing and be notified ahead of time that their child has been selected for the month. In a typical school year, teachers return to school for a few days before students return to prepare for the start of this year. And we're extending that preparation time for educators to prepare their physical and virtual rooms for a new year of learning. This time will allow teachers and all staff to set up students for success, both in full-time remote and blended learning models. School leaders and educators will be fully trained on health and safety protocols and have ample time to coordinate with each other to ensure that they can provide the educational continuity between remote and in-person days for blended learning. And this is important because imagine a student that is 3 days in person and 2 days in remote, they're going to have 2 teachers. So the in-person teacher and the remote teacher need time to collaborate, coordinate, and make sure that the in-person and blended learning students are on the same pace, are on the same program, and have the same practice as they go forward. That's what we mean by educational continuity. Health and safety continues to lead all of our reopening plans, and the city will not reopen schools if the citywide infection rate exceeds 3%. Currently, the citywide infection rate as of today was 0.7%, less than 1%. Now, there's been a lot of talk about air quality and air safety, and I know that everyone is interested in learning more about how we're preparing our buildings to make them as safe as possible. We announced last week our comprehensive air safety plan, and I want to tell you about the school ventilation action teams. Each action team is made up of independent, not DOE, independent ventilation experts that are certified and professional engineers that have been contracted by the school construction authority to do walkthroughs through each and every room where learning will happen in the New York City Department of Education. The Fire Department of New York City, the Department of Buildings, and our hardworking DOE custodial engineers will also contribute to inspecting and walking through each space to make sure it's ready for use on day one. Each classroom in our schools must pass a checklist with important details. Some of them are like room size and occupancy, and is there proper social distancing? Do we have windows and can they open? And if we have more work to do, what is that work that we have to do to make them operable? An examination of supply fans and exhaust fans, an examination of filters and HEPA filters. The DOE will make those findings and do one of three things. Either, number one, the room is fine and ready to go. And remember, we've been at work on ventilation all summer. We expect this to be, by and large, the most prevalent result of these walkthroughs. Or number two, the room needs some repairs or adjustments. And we'll make all the necessary changes to ensure sufficient ventilation in that room has taken place before the first day of school. Or option number three may be that there's just so much that needs to be done, we can't do that before the first day of school. So we'll take that room offline until those repairs can be completed. I'm happy to report to you that all of our classrooms and school buildings walkthroughs were completed at the end of business today. So we will have more to share about what those results are in the near future. We're in motion already, ready to make good on these promises, and we've purchased 10,000 portable air filters for nurses' offices, isolation rooms, and any rooms that the inspections reveal need additional circulation. And let me repeat this. If an inspection finds an entire school or a particular room does not have adequate ventilation, this is my commitment very publicly to our parents, staff, and students. We will not allow anyone to use those spaces until they are made safe for occupancy. Again, we will be again posting these results later this week, and those inspections were completed today. All students and staff will be teaching and learning in safe spaces with proper ventilation. That's our promise to you. And the science is clear. Well-ventilated buildings are safer buildings, and these action teams will help us to make that happen. So I just want to also be clear that as we've worked with our medical experts, they've been clear that ventilation is but one of many things that you need to do to ensure a proper space to mitigate the spread of any possible virus. Number one, and first and foremost, is the use of face coverings, a mask. So that's why we're requiring masks to be used. Number two is social distancing, keeping distance between and among people in a room. That is part of our plan. Number three is the constant 24-hour disinfecting of heavily used or general population used spaces like handrails or doorknobs or levers. That will be happening. Number four is to ensure that we have deep cleaning with electrostatic cleaners every night to disinfect all of our classrooms, all of our learning spaces. That will happen. And number five is to ensure that we have proper ventilation, that air is circulating. And by the way, it may seem like an old school solution to a modern day issue, but one of the best ways of exchanging air in a classroom is to open the window and make sure that windows are properly working, which is part of our process. So all of those things, it's not like you do one of them and not do any of them, any of the others. You have to do all 5 of them in tandem to have the best possible option of preventing the spread of a virus. We're doing all 5 of them and more. So speaking of science, I am pleased to be joined this evening by Dr. Danny Stevens, who is a Deputy Commissioner of the Department of Health and Mental Hygiene. I will tell you that he is a medical doctor. I will tell you that he's an expert in epidemiology. I will also tell you that he also has a soft spot in his heart for public education because he's a former 4th grade elementary school teacher before he went back to medical school and became a medical physician. So I'm glad that Dr. Stevens is with us this evening. And with that, we're happy to take your questions. And I'm going to turn it back over to our Deputy Chancellor, Adrian, for the questions.
Thank you, Chancellor. Before we dive into the questions, I know Dr. Stevens actually has a presentation. So looking forward to seeing the presentation. And I'm going to turn over the floor to you, Dr. Stevens.
Thank you so much. Hopefully everyone can hear me. I'm trying to learn to project. I really appreciate the opportunity. Thank you, Chancellor. Thank you, Deputy Chancellor Austin. I really appreciate this opportunity to engage and speak with you tonight to share good and solid information. I think that's one of the tools that we have to combat and try to, as the Chancellor said, limit the transmission of COVID. Really good and pertinent information can be key, and that's what I want to share this evening with you. The Chancellor talked about some of the recent plans, and I want to kind of go through an overview of several things tonight, but really touching on where we have been, where we are, what we're doing as a city, combined with our partners, because we are a team in this, as the Chancellor alluded. It is all hands on deck and has been so for a while. And then also talk to you a bit about what we can all do to kind of protect ourselves and really try to continue the strides we've made in battling this pandemic. So that's how I intend to spend my brief time with you tonight. So let's go ahead into the presentation. Just so everybody knows, as with all things, we are as knowledgeable as what we know right now. So this is the best knowledge we have based on September 1st, 2020 at 3:30 p.m. when this was the last review. So just wanted to let people know that. Kind of moving forward. Okay, slide please. As I talked about, we're going to talk about where we are, give you an overview with data, both from worldwide, national, and city. Give you an update on both the state and the city response, and then spend a good amount of time talking about protecting our communities and what you can do to help. Next slide, please. So we are 7 months into, at this point, what I will say is an unprecedented pandemic, COVID-19. We have all seen life change on almost every level. Where we are now is our number of new cases, hospitalizations, and deaths to COVID remain steadily low. As a city, we have gone through it. The rates climbed, and in the spring we saw a great deal of transition and resulting loss. But New Yorkers stepped up, did what we needed to do, practiced our core principles, which the Chancellor talked about, which we will continue to talk about, doing our part to try to curb and limit transmission, and we saw those rates come down. Again, we definitely saw some loss, but this is the time to have energy. We can't let our guard down. We've seen what's happening in many other states, and so we will continue to come back to those core public health principles. Staying home when you're sick, physical distancing, face coverings, good hand hygiene. We talked about those and we'll continue to do so in terms of critical elements to stopping the spread. Next slide, please. This is a reminder of our core 4 with images. I am not a good artist, but I do like a good visual. So those core 4 public health principles: staying home, physical distancing, hand washing, face covering. Cannot repeat those enough because that is the basis of our guidance that we really want to implement everywhere in our schools, in our communities, in our homes, in our places of work, in our places of worship. We really want to kind of come back because that's going to help us protect ourselves. We are going to keep ourselves safe. Okay, next slide, please. I see my audio is breaking up. I'm going to lean in and speak a little bit louder. Hopefully that helps. This is a busier slide. So this is a world map. And just to point out, we've had over 25 million cases in the world with over 850,000 deaths, unfortunately. And you can see by the color pattern where it's been worst, and we're there. That's the United States there in that darker red. Next slide. Looking nationally, if you look at this is the picture nationally, with over 6 million cases in the US, and now we're topping over 184,000 deaths. As far as New York City, as of today, we've had over 230,000 cases, and we have suffered about 23,000 confirmed and probable deaths. Now, if you look at the rest of the state, there are another over 200,000 cases, but New York City still represents a little bit over half of the cases in the state. And again, what we know now that we didn't know, right, with all of our efforts to really detect and test, we know that many people who've had COVID were not tested and aren't reflected in this data. It has really affected us and us as a city. We have seen this up close, and I think that, as I said, we have done what we can and should do as a city to step up to get those rates of infection back, as the Chancellor said, today, under 1%. And that is, while that is encouraging, we cannot let up, but that is the result of our continued and ongoing effort, and our partnerships as a community are going to help us to keep things in a better spot. This is our city map. It's a little bit busy, but if you can see, again, by dark and shades, the neighborhood distribution of the cases that we've had. This and a lot of other information is on the health department website, and so I encourage you to check there because we have information about cases, hospitalizations, deaths, and other data. We did not always have this data available, so I do want to kind of, again, stay in the moment as best we can. There's a lot of data, so I encourage you to check it out there on the website. Next slide. If we're talking about data, this is where I need to actually point out our health disparities, right? Because as we've gone through this last 7 months, we've noted that Black and Hispanic and Latinx communities and persons have accounted for a disproportionate number of the cases, the hospitalizations, and deaths. And these disparities may be related to anything from rates of pre-existing conditions, the obstacles in practicing physical distancing if folks have to take public transit and have to go to work if they're overrepresented in frontline essential worker roles, healthcare access issues, other social determinants of health, and let's talk about it, structural racism. All of these have contributed to some of the inequities and disparities that while we have data, we want to turn that data into action, and I'll be talking a little bit more about that. Next slide, please. So how are we addressing these disparities? We have launched digital media campaigns in a variety of languages, targeting those communities most affected, creating task forces from the city to the neighborhood level to address inequities. We have a no-cost air conditioning program to low-income households. If you think about cooling centers that we would normally have in the summer, that is very difficult in a time of a pandemic and physical distancing. So some innovative and different approaches to things, targeted testing initiatives, involvement in communities and contact tracing efforts, everything from advisory and a community advisory board to hiring people from those communities most impacted by COVID to be a part of the test and tracing team. Again, it's all hands on deck. Who is most at risk for COVID? This has been something we've talked about and I want to come back to. Older adults, those are 65 and over, people who have underlying health conditions, and I encourage folks to keep an eye on this because we know more now, and so this list looks longer now. I remember when this list was 5. So any cancer, chronic kidney disease, obstructive lung disease, obesity, heart disease, sickle cell disease, type 2 diabetes, things that compromise your immune systems, those are folks we want to particularly protect and put measures in place to keep them safe and well. Next slide, please. How is it transmitted? We know that it is spread to those who are in close contact, that is within 6 feet. by someone who has COVID when the person either coughs, sneezes, sings, or talks. We know now that people with no symptoms can, in fact, spread the virus. And it may be possible for people to get COVID by touching surfaces that has the virus on it and then touching what we call their mucous membranes, their mouth, their eyes, their nose. But this is not thought to be the main way the virus spreads. It is mostly thought to be a person-to-person contact. Again, we know more than we did, but there's still a lot that we don't know, and we need to be transparent and share out what we know as we know it. Next slide, please. This is a busy slide, but I want to talk about the symptoms and treatment of COVID. Right? Again, we are learning more and more. There are a wide range of symptoms, and the severity can range from mild to very severe illness. We know that they can appear as little as 2 and as many as 14 days after exposure to the virus. More common symptoms include fever, cough, shortness of breath, loss of taste of smell, but there's an entire range and spectrum of symptoms that you can see there as well. But really, we're going to be focusing on those symptoms as we try to kind of move into plans to detect cases as they come, because we know that there is still low transmission. We've done what we can to kind of keep it low, and to use that information in a preventive and proactive way to protect our communities, including our school communities. Just a note about MISC, multi-system inflammatory syndrome in children. Some folks have heard about this, some folks haven't. This is a very rare but very serious inflammatory condition in some children, and it's been associated with COVID-19. Most of all of these children present with several days of fever along with a constellation of other symptoms. These kids can get very sick. We have kept an eye on this, keeping up with the latest research, partnering with our communities in the pediatric, with our partners in the pediatric community, getting information into folks' hands to make sure they keep track of this. If you see a child who is very sick with a persistent fever plus other symptoms, we encourage them to seek care, go to the hospital, and call 911 if it's an emergency. Again, this is very rare, but it is something we are keeping eyes on, and I wanted to share that with you here this evening. Next slide, please. So in terms of testing, I know the Chancellor mentioned expanding testing. I want to talk a little bit about that. We've got 2 types of tests. We've got a diagnostic test, that's to detect the virus or evidence of the virus. That's either a swab in the nasal area or saliva, that's another word for sputum or spit, that shows that you have COVID now. And there's an antibody test. It's a blood test to show if you've had COVID in the past. You may be over the illness, but you may have circulating antibodies that your body has built to fight it. And we have a test that detects that too. Just to distinguish between the two, the antibody tests for things that your body produces in response, and it may not work to show if you're sick now. So it's really important to understand those differences so that we're interpreting those tests to take the right actions. Whether you have had it or in the past shouldn't change your behavior. We encourage folks to get tested. More about that in a minute. So what are we doing as a department? Enhance surveillance to track the disease spread, educating the public through virtual town halls like this. This isn't the kind of town hall that we used to have last year, but we're all changing our patterns. Webinars, social media, guidance documents, media campaigns, targeted testing in community settings, assisting in contact tracing, including schools, childcare programs, and long-term care facilities, providing guidance to our provider community, to doctors, hospitals, other healthcare facilities, nurses, nurse practitioners. Those folks have been on the front lines. They know a lot. We want to continue to equip them with the best and most up-to-date knowledge to continue this fight. And opening COVID express testing sites at the express sites with the Department of Health runs, where results can come back in 24 hours or less. Expanding our lab testing with our partners, making sure we continue to give folks access, and planning for the future phases of the pandemic, including a possible resurgence and for a vaccine once that becomes available. Not yet, but once it becomes available. This talks about other social determinants of health that set people up for success. So we are also partnering with and well aware of the Get Food program and the Department of Education meal hubs, promoting safe separation and quarantine for New Yorkers who may qualify for hotels for isolation free of charge, and other resources for New Yorkers that's available on that website. Please continue. I want to talk about protecting our communities, who should seek medical care, what to do if you're sick, when to seek emergency care, taking care of your mental health, which is a very important part of this time, and preventing stigma, as well as staying informed and good information. I'll go through these next quickly, but I think it's really important. Who should seek care for COVID? Everybody is encouraged to get tested, regardless of symptoms or risk, right? We're encouraging New Yorkers to find a testing site, and particularly our Department of Education colleagues. We have prioritized over 30 sites throughout the city. We invite, encourage, and welcome you to get tested. They are free. Just so you know, testing services and care services are not a public benefit under the public charge rule. There's a lot of talk about public charge, and I want to be clear, this doesn't fall under that because there are some dynamics around that, and we want to be clear what this is and what this isn't so that people have a path to accessing our testing and treatment services. If you do test positive or have symptoms, you want to stay at home, right? And if you do not feel well, we want you to consult with your doctor, particularly if you're an older adult or have underlying conditions that put you at risk for more severe illness. And we've seen the expansion of telemedicine. So really there may be other ways to speak with and communicate with your providers that allow you to stay safe at home. Next slide, please. How long do I need to stay home if I am sick? So this is important. If you were confirmed to have COVID or you tested positive, you need to stay home at least 10 days, right? And even if you hit 10 days, in addition to that, you need to be symptom-free, and you definitely need to have not had a fever in the past 24 hours. That's without any medications to reduce fever. So it doesn't count if you're taking Tylenol and Motrin to kind of keep your fever down. You need to be fever-free, symptom-free, feeling better, and at least 10 days. Reason why, as studies have shown, folks don't shed the virus past 9 days, so that's that window that that's behind, the science behind the guidance we're giving. If you do test positive, we want you to take care of yourself. That's fine. Next slide. This is a busy slide, but I'll just break it into. Publicly, if you are sick, do your best to stay out of public. Stay home if possible. Only leave home if you absolutely have to. And that is to seek care, right? If you absolutely need to see a provider, on your way, please wear a face covering, physical distancing, be especially careful of hand hygiene, try to walk, avoid public transit, public spaces, and do not have visitors come to your home. That's limiting the spread. And then in the home, you want to separate yourself as much as possible. It's really hard to do in our life in New York, but you want to try to separate yourself. You want to try to be judicious and really careful. Good hand hygiene, try to separate things. Don't share towels, eating utensils, cups, glasses. Clean surfaces frequently. And again, those core four, wear a face covering, practice safe distancing, wash your hands, and really try your best to stay at home. Next slide. Is it safe to get care? We have been talking a lot about COVID, but let me stress, we understand you're worried about going to a healthcare facility, but they are on their toes at P's and Q's as well to make sure they are practicing best practice. It's important to get medical care you need, especially if you delayed getting care. So it's important to get your annual preventive care exams, to make sure you're up to date with your vaccines, especially in children, to take care of your chronic conditions, ask your doctor about symptoms that have gone unchecked, and this year particularly to get your flu shot. It's important to stay healthy and preserve healthy healthcare resources this coming fall and season. Where can people get medical care? I love that I live in New York. We have the biggest and the best public hospital system, and so calling 311, you can find help navigating our New York City Health and Hospital facilities. They welcome all New Yorkers, regardless of immigration status or ability to pay. I used to work at Health and Hospitals facility. I am proud of our systems and what they offer to our city. 311, I mean, they have a number as well, but 311 is easier to remember. Next slide. When should I get emergency care? Now, this is, if you are really experiencing shortness of breath, pain in your chest, new confusion, there are emergent situations where do not pass go, do not collect $200. You want to, get care, or you want to call 911. These things haven't changed, but we want you to particularly be aware of those in the age of COVID. Next slide, please. I see. I will talk a little bit slower. Taking care of your mental health is very, very important. It's natural to feel overwhelmed, sad, anxious, and afraid. A great deal has happened, and none of us are unaffected by this. Please stay connected with friends and family. Stay connected with trained counselors at NYC Well. Think about emotional well-being. Is more broad than mental health. Do things that support your well-being. And really, emotional health. Think about the resources. Text 65173. Text WELL to that number to get connected to resources. And there are resources available and helplines available 7 days a week. Next. Lastly, I want to talk about stigma and discrimination because this is another pandemic that is affecting the well-being of our city. It's important to separate facts and fear and guard against stigma. We're learning more and more, and it's important that we all stay on top of things. With that knowledge, we know that we need to treat all people with respect, and we're not about singling people out based on race, ethnicity, what country they're from. It doesn't serve the city. It creates distrust. It discourages people from getting help, accessing care, supporting one another. It's not who we are as New Yorkers, and I'm really proud of what we've done. Almost done. It is illegal to discriminate. We all know this, but I really can't come back and say that often enough. We don't do that, and it's illegal. That's like, if you've been experiencing or are the target of, want to highlight that there's a New York City Commission on Human Rights. You can call 311 and say human rights, and you can be directed there for a path to addressing these issues. And lastly, information. Knowledge is power. I want you to reach out for accurate, timely information. The City Health Department website, the State Health Department website, the CDC website, check them regularly. We're updating them with more information, more data, more maps and graphs for those who like those. There's a lot there, and we want to make them as accessible and understandable as possible. More knowledge is a good thing. And with that, thank you. I know I took some time, but really wanted to thank you for the opportunity to share this information.
Thank you so much, Dr. Stevens. It was time well spent. You went through a lot of detail there, and we are really grateful that you did. So I want to quickly bring in our Chief Executive Officer of DOE's Office of School Health, Chris Grohl. Chris has been a senior leader in the Department of Education for over a decade. He has been instrumental in developing our health and safety protocols. Chris, thank you so much for joining us tonight. Can you give us just an overview of DOE's school reopening health protocols?
Yes, I can. Good evening, everyone. I'm excited to be here tonight. I just want to thank Chancellor Carranza and Deputy Chancellor Austin for their leadership and for inviting me to join tonight. So as Deputy Chancellor Austin mentioned in her introduction, I'm currently serving as the Maine Department of Education liaison for health and safety, partnering with Dr. Stevens, his team at the Department of Mental Health and Hygiene, as well as health and hospitals, and all other partners as we continue to learn new things every day and work closely to ensure this health and safety of all our students and staff. So many items were discussed. The Chancellor touched on lots of things that we've been looking at and talking through over the last several months. I'm going to take us through a quick overview around the key tenets of the Department of Education plan, but more importantly, I'll end with what do we do when somebody in the school gets sick? What do those protocols look like? And I will take us through some of the day-to-day protocols that are in place right now. As I know that's usually the number one question, and I see that some of the questions that were shared with me in advance are around some of those items. So most importantly, as the Chancellor and Dr. Stevens have mentioned, the health and safety of students and staff are the utmost priority when considering reopening schools. The guidance that I'm going to speak to and the guidance that we've submitted to the State Education Department and the State Department of Health, we're clearly in partnership with the Department of Mental Health and Hygiene and Health and Hospitals. Also, as we work through these key plans and these key tenets, they are aligned to the CDC guidance as well as the New York State Department of Health guidance around school reopening. So the main four tenets that you see on the screen are really around promoting behaviors that reduce spread, maintaining healthy environments, healthy operations, and most importantly, preparing for when somebody gets sick. So I could just quickly move to the next slide. So as we've talked and heard, for months now, and the Chancellor just touched on, physical distancing is extremely important. We spent all summer working closely with our space planning division, as well as our division of school facilities, to ensure that classrooms were not only well ventilated and cleaned, but more importantly, that furniture was set up and rooms were really set up to ensure that when students arrive, the proper physical distancing can happen. We are recommending that all staff and students wear face coverings throughout the day. However, we are aware that there will be some exceptions. There will be some students that are developmentally and age appropriate. It's tough for them to sometimes wear face masks throughout the day. Consistent with our guidance from the CDC and health agencies, we will be looking at those students with sensory issues, some students that have medical reasons why it's very difficult to tolerate a face covering. So we will then be providing enhanced PPE for those staff working closely in a one-to-one or small classroom setting with those students that will not be able to wear a mask. The New York City Department of Education has procured and distributed PPE to all students and staff. We have a 30-day supply in each building. Principals are aware and have been informed to notify the custodial engineers as supplies begin to run low, and those will be immediately sent out to the buildings. So that's exciting. We learned a lot as this pandemic has grown, as Dr. Stevens shared. This is the best information as of 3:30 yesterday. But some of the changes around face coverings and PPE have been in regard to, really ensuring that certain staff and students have access to items that are necessary and needed. So for those that will be working on our building response team, for those nurses who are on the front lines in schools, for those staff that are manning isolation rooms, there will be enhanced PPE. So we've ensured that face shields, K95 masks, N95 masks, as well as isolation gowns with sleeves, and also gloves are available for all staff in all situations that we recognize and have learned over the last few months how to protect our staff as they're working closely with students in a close situation, or more importantly, who might be presenting with symptoms. The next key tenet, and we hear about this all the time, it sounds simple. Dr. Stevens touched on it, but clearly just reminding students and staff that keeping their hands clean is at the utmost priority. The Division of School Facilities, under the Chancellor's direction, has worked closely all summer long to ensure that all sinks in each school building are working, and that more importantly, when a sink might not be available, that every classroom, common area, and every entrance has hand sanitizer dispensers available throughout the day. Lastly, we believe that one of the key things here is education and signage and floor marking. So continuing to promote these behaviors, continuing to put signage up around hand washing, physical distancing, and face coverings is extremely important. And there'll also be floor markings upon entrances and in common areas to ensure that folks know and are aware of the proper distance when walking to school, when exiting school, and more importantly, when moving throughout the building. Next slide, please. So some of the things that I just quickly mentioned, so there'll be lots of changes this year. The Chancellor mentioned that this year will not look the same as any other year, so many changes will happen to the school building. We've worked closely with our superintendents and our principals to develop rules and protocols around movement throughout the building. So really encouraging classrooms to keep students together, to have teachers continue to work closely with those students, and to try to limit any intermingling, for lack of a better way of describing it, across classrooms or across groups. So in order to do that, spaces need to be reconfigured, programs needed to be rethought. The Chancellor mentioned, what will look like as far as instruction and blended learning, but more importantly on the classroom side, just really setting things up to ensure that we can physical distance properly and that students and staff will be safe. Chancellor also touched on the cleaning and disinfection. So we are clearly ramping up. There'll be a deep cleanse every day. I will get into in a few minutes a little bit around what's going to happen with isolation rooms and if somebody presents with symptoms and what the cleaning protocols will look like. But really, excited to see the work that's been done, the supplies that's been ordered. The one advantage for schools not being open since March is that buildings are as clean as they've ever been because staff has been working around the clock and ensuring that all those things get done. The next big thing around maintaining healthy environments is around our food services. So grab and go meals will be available for breakfast and lunch each day. Students will also be permitted to bring their own lunch if preferred. Doing so will allow flexibility for students to physical distance while maintaining the proper protocols during lunchtime. Also, lunch will be in classrooms to minimize interaction between groups of students and prevent the possible spread of the infection. And if the cafeteria must be used, we will consider personal dividers and assigned seating to ensure that in those places and in those buildings where they can eat in the classroom, the lunchroom is safe for students to eat and properly distance. Next slide. So testing, the Chancellor touched on testing, so I'm not going to get into it. More information will be happening over the next week, so please look out for that. But just to quickly give the big highlight is that school-based staff are strongly recommended to get tested for COVID-19 at least a week prior. This week, we've shared information with all staff. 160,000 staff members in the city received information around how they could be prioritized for testing and which sites they can go to. And we have a commitment from those sites and those partners to deliver results within a 24-hour turnaround, which is exciting and a testament to the work that the Chancellor has done with others to ensure that folks that are entering school buildings as we reopen are safe. Next slide. So I'll spend a few minutes more and dive a little bit deeper here. So I just want to again remind folks that the Chancellor mentioned that in order for schools to reopen and stay open, the percentage of positive tests in New York City must be less than 3% over a seven-day rolling average. However, that does not mean that schools might not need to close if that percentage is still below 3%. So we've worked closely with our partners at the Division of Mental Health and Hygiene, and we've developed clear protocols around what happens when somebody gets sick in school. So just so you're aware, every school will be asked to set up an isolation room, and in that isolation room, we'll have a designated staff member who will have the proper PPE. A student who presents with symptoms during the day will be sent to the isolation room. They will be met by the designated staff member. The student will also be given the proper PPE if they don't have it on them. They will be sitting waiting for the nurse. The designated staff member will call the nurse. Nurse will come to the isolation room to evaluate the student, and then the student's parent will be called if that student presents with some of the COVID-like symptoms that Dr. Stevens mentioned. What gets tricky here is obviously we're approaching allergy season, we're approaching flu season, and we know that many of the symptoms that Dr. Stevens reviewed look and sound like other things. So our nurses have been receiving ongoing training this summer, so they are aware of what to look for. And if a student presents with COVID-like symptoms and they believe that those symptoms are COVID-related, the parent will be called. The student will be given, and the mom will be given, or dad or guardian will be given the information around where that student could be tested. Immediately, we ask that the student go to be tested and to let the school know the results. And I'm going to talk us through a little bit about what happens when a student or a staff member tests positive, and then I'll end in a few minutes with what potentially could lend itself for a school closure. So if that student tests positive, Immediately, that'll activate the BRT at the school level. So each school has a building response team that has been trained this summer, and will be leading the response when there's a positive case. That person who is positive will be called by our partners at the Department of Mental Health and Hygiene, and that's when you hear a lot of the language around an investigation and test and trace. So the parent will be called, the principal will be called, and an investigation will start to determine whether or not there was anybody else that was exposed or in close contact with the positive case. If it's determined that those folks that might potentially have been exposed, we ask that they will quarantine for 14 days until the incubation period ends. Also, immediately in the protocols, if a student tests positive, all students in that classroom will be asked to quarantine for 14 days as well, and also the teacher. However, the teacher, since they're an adult and the assumption is that they will be able to properly social distance and wear PPE, they will be interviewed to determine whether or not they have been exposed. If so, they will remain out for 14 days as well. If it's been determined that they maintained proper social distance and that they were wearing their mask and that as an adult they were able to answer the questions and it was deemed that they weren't exposed, that teacher could then return back to the classroom. However, that classroom won't be used. It will be shut down for the 14 days until the incubation period ends. So if there is a potential second case, so let's just say another student in that classroom also tests positive over the course of a 7-day period, Test and Trace and H&H are looking closely, speaking to those folks that they've asked to quarantine and touching base regularly. As soon as it's determined that there is a second case and that second case is linked to the one that was in the classroom prior, there will be conversations around shutting the classroom down, looking at other potential places in the building that there might have been exposure and considering additional closing of additional classrooms or potential common areas. If it's determined that there's a second case and that second case is not linked to the first case, the school will be immediately closed and an investigation, the school will be immediately closed for 24 hours at minimum while an investigation starts to determine whether or not there is a spread happening in the school. So as the Chancellor alluded to, and as I mentioned to earlier, even though the city has a 3% threshold, we are looking at individual cases in school, every single one of them. As soon as we hear of a second case or any cases beyond 2, schools will be closed. An investigation will happen over a 24-hour period, and it will be deemed at that point by the Department of Mental Health and Hygiene whether or not schools could reopen. So as you could tell, I mean, we're spending lots of time thinking through the ins and outs. We've been practicing on a daily basis our tabletops. We have emergency scenario conversations to practice these protocols, to tweak and figure out where we might need to make some changes as we prepare for school opening. There are also daily calls just around the daily infection rate in the city, working closely with Dr. Stevens and his team as we look at specific zip codes and where there's potential spots where we're noticing potential upticks and infections. So that's basically on my end, the information that we've been working through and more importantly, preparing for when and if somebody gets sick. I'll end with just a slight conversation quickly around communications. So the one thing that we will be doing is every family will be communicated if there's a positive case in the school. So whether you've been exposed or not, you'll receive communication directly from the school. If there's been a direct exposure, those parents will receive a different form of communication, letting them know what symptoms to look for, where to go to get tested, and who to contact if their student themselves also comes down with symptoms. So thank you for your time. I know that there's lots of questions, so I'll turn it back over to Deputy Chancellor Austin and look forward to answering some of the things that are on your mind. Thank you.
Thank you, Chris. Thank you, Chris and Dr. Stevens. This was really jam-packed full of really helpful information for our families and really detailed information. We are going to dive into our questions. Before we do that, I just want to acknowledge we have Sal Calderon, the Executive Director of our Office of School Facilities with us tonight, and he's going to be able to answer some great questions that we have around facilities, air ventilation, and other questions. So thank you, Sal, for joining us. And with that, we're going to go to our first question. Our first question is from Laura Gobel from PS 176. And she wants to know, and I think this is for Dr. Stevens, she wants to know, what are the sanitation standards for medical offices? And I think what she's getting at there is, how do our safety protocols compare to those medical standards?
Great. Can you hear me?
Yes, sir.
Right, I'm back on. So that's a great question, and we spare no one. We have the exact same standards as all of the medical offices. So we're actually, medical offices are cleaned, and this is the same recommendations for all city medical facilities, inpatient, outpatient, as part of regular cleaning protocols when in school, and the deep cleaning that happens at the end of every day are a part of that as well. But surfaces will be wiped down between student visits, so the same thing at provider visits. And that's a routine part. We are holding our medical rooms to the same standard that we hold our other facilities.
Thank you so much for that answer. I think the next question is for our Chancellor. Chancellor, this is actually from one of our parents, Rocky Bonanno. He actually corresponds with us quite a bit. And he had a question around random testing and what the policy is there. And I know we recently issued a policy. So Chancellor, can you talk to us a little bit about the random testing of students and staff in schools?
Yeah, so in consultation with our medical experts, so we're going to do between 10 and 20% random testing every month, which gives us a statistical certainty about the spread or lack of spread in a school environment. So we're going to ask all parents to sign a letter of authorization for their students to be in an in-person learning environment, available to be part of that random sample. And we're going to ask parents and students to be part of that because it's part of keeping our school system safe. We've also prioritized, as I've said, that the results will be available within 24 to 48 hours to parents and students. And that's because we want to make sure that we have this constant cadence of testing so that we know that everybody that's in a school building is COVID-free. If there is a case, we've already talked about what our policy is. If it's in a class, the teacher and the students in that class will quarantine for 14 days. We'll do a deep cleaning. If it's more than one class, then we will take the whole school offline for at least 24 hours while our contact and trace experts do their investigation. But the whole goal is to really contain and keep students and staff in a learning environment.
Thank you, Chancellor. That just leads to a question around investigations, a test and trace investigation. And Dr. Stevens, you're here with us. Can you tell us, what does that mean, a test and trace investigation? What does that all entail?
That's a good question, because I think it's named a lot, but not described. So that's really, people call them disease detective work. I like that as a framing. It's really trying to figure out, really, if you have a positive case, it's reaching out first to the person to figure out where they've been, right? How did that person come down with a diagnosis of COVID? Really figuring out, based on strict criteria, the distance, the time that they've been around others, where they've been, where they haven't been, how long they've been there, to really figure that out. And then in addition, one level out to figure out their contacts. So those are people they've been around in a way that's long enough that meets the criteria for the probability or likelihood of transmitting COVID. So there's two objectives. One, to try to protect the person that has been diagnosed, but two, there's three, understand their contacts, right? And really try to isolate and quarantine those contacts. They're quarantined because they're not sick yet, right? They're not diagnosed, but try to reduce transmission by getting those folks somewhere safe where they're away from others and not likely to then transmit it to others. So the third benefit is to the community by really trying to keep those who are at risk of transmitting it isolated or quarantined, depending on if they're a case or if they're a contact.
Thank you very much for that explanation. Our next question comes from Nicola Wang from IS 281, and she wants to know about frequency. Will schools in the city keep on monitoring the staff and students frequently so that we know who is infected and so that we won't spread during the fall and winter terms? So do we know how frequently testing is going to happen?
Yeah, I'll start and then I'll turn to Chris and then Dr. Stevens. So absolutely. I mean, the whole point here is to have a constant pulse on what's happening in our schools and then juxtapose that with what's happening in our city. So absolutely, we're going to be, we've set up, I'm going to call it a war room, but it's a real-time management center where the Department of Health, the DOE, and other city agencies are monitoring what's happening in our schools and in our city to make sure that we're able to make some decisions in real time about what we need to do. Chris, Dr. Stevens, what do you think?
Yeah, so totally agree, and I'll just share also that part of that conversation that happens in that room is around looking at the local daily infection rates, also working closely with Dr. Stevens and his team as we monitor pediatric visits and look and see what's happening as far as sickness in our students across the city. And I think that's extremely important, while coupled with the encouragement and the recommendation around this serial testing for staff and students. Dr. Stevens, you want to dive a little bit deeper into some of the daily items we're looking at?
Sure. I think it's a great question because it gets into what data, how often we're looking at the data, and really, what are we doing with it, right? What good is that data doing to help us translate that into protecting our school community and all of us who are invested there. So we are taking a look, as you said, at citywide percent positivity, right? The rate and number of folks who are newly diagnosed, who have not yet been diagnosed with COVID before. We are also taking a look at percent positivity rates by zip code, broken down. We're taking a look by age. We are, our surveillance and epidemiologists take a look at what are the real numbers behind the rates, right? For all of my math people, understanding true significance, and then separating noise from signal, taking that into neighborhood level looks at what's going on, as the Chancellor alluded to, putting together what we know from the testing in our schools, with the testing in our communities, to what we're seeing in the primary care setting, who's presenting to the hospitals, who's getting sick and reporting there, and trying to put it all together in a picture of where we are, how we're doing, and what needs to happen.
Thank you very much. Our next question, this is a kind of big question. It comes from Donald Hewins, and he wants to know, what are the CDC guidelines for students going back to school? And I think it begs a larger question. What's your relationship at the Department of Health with the CDC? How often are you experts coming together to talk about this and share information?
I'm unmuted. I'm gonna jump in there. To describe it as a relationship, we don't just check in with CDC, we keep an eye on our Center for Disease Control. They are our lead agency in our country. They have information that goes beyond what any of us have. And it's an interesting time because we are looking at what the CDC is saying, what New York State is saying, and the city. And what I really enjoy is the way that the CDC is set up is you are allowed to be more strict, but not less. So what we're doing in the city is taking our CDC guidance, looking at the state guidance, and we are allowed to be even more strict and more safe. That's something that we can kind of choose to do. The Chancellor mentioned that the city has a 3% threshold to open. Our state requirement was 5%. We made a decision to really try to single in on what would be safe for us in our local community. So the CDC guidance is something that affects everything from facilities to classroom instruction to testing to treatment. We have adhered to their guidance in all of our plans and planning and keep a constant watch on their guidance.
Thank you very much for that answer. The next question comes from Elaine Vera from PS 162. And she says, as a medical professional, I feel like a 3-ply mask should be worn at school. All other ones you might as well not use. Can you give us some guidance on what kind of masks are you all suggesting? And then if we can hear from the Chancellor and team about what are we providing to our nurses? What are we providing to our students and staff in terms of masks?
Sure, I'll lead off. There's broad agreement that wearing face coverings is helpful in reducing COVID transmission, right? And I know that there are many, many options for use. So at the present time, 3-ply masks aren't what we are recommending. We're not recommending against them for DOE staff, but we know that face coverings help to protect us, right? And that's why students will be required to wear face coverings. Research is ongoing regarding the effectiveness of different kinds of face coverings, and we'll update our guidance as necessary. Please keep up with the latest guidance that we are putting out on our website, and know that we are, again, keeping an eye on the best and most recent guidance that's coming from our partners at the CDC and New York State.
I will only add to what Dr. Stevens has said, is that whatever our partners are telling us we need to do, we will provide that for our staff. So there's no discrepancy. If Dr. Stevens and his colleagues say you need to do X, Y, Z, we're going to do X, Y, Z. So we're going to keep up with the most current medical knowledge and guidance.
Thank you, Chancellor. This is a follow-up question for you, Chancellor. It comes from Henry Roosh from PS 166 in Manhattan. And he wants to know, will young children, 5 to 8-year-olds, wear masks? And what is the latest health guidance on taking temperatures as a precautionary measure?
Great question. So we're gonna take temperatures. There's a lot of, and again, I'm not a physician. I'm not. But in speaking with my colleagues that are physicians, there's some mixed opinions about how relevant is the taking of temperatures. But I will tell you this: as a parent, if I'm sending my child into a school, I want their temperature taken. So we will be taking temperatures for everyone that comes into a school building. We will be limiting the amount of and the extent to which anybody enters a school building. But it's also important to understand that we are in a global pandemic. I just want that to rest there. We're in a global pandemic. This is not business as usual. So if a student refuses to wear a mask, by the way, let me just point this out. We have regional enrichment centers that we've stood up since the moment we transitioned to remote learning, that have taken care of the children of first responders, essential workers, medical personnel. We have not had any cases of a spread in those educational enrichment centers. So we have great practices that we're building on already, where we can control what that looks like. So but let me be clear. And sometimes, look, I'm not always known as being the most politically correct person, but I just want to be honest with people. We are in a global pandemic. If you refuse to wear your mask, we're going to educate you. We're going to support you. We're going to cajole you. We're going to make it fun. We're going to help you understand why you have to wear a mask. But if you refuse to wear a mask, if you refuse to follow the safety protocols, then you have elected 100% remote learning. Because Thomas Locke spoke of the social compact. Here's my government teacher coming out. Thomas Locke spoke of the social compact. There are things that we have to do that are for the benefit of the whole. So if we're going to be in in-person learning, we are going to wear masks, we're going to socially distance, we are going to be in, at the greatest extent possible, in pods. And if you refuse to do that, then you've elected to be in remote learning in your home or wherever else, because you cannot be part of the social compact keeping everybody safe. It's just that simple. There's no option, there's no discussion. It's not we're going to go back and forth and it's your rights and our, there is no discussion here. If you're not going to wear your mask, if you're not going to practice social distancing, if you're not going to follow the best practices that our medical professionals tell us we need to practice to keep everyone safe, then you've chosen remote learning. It's as simple as that.
Thank you so much, Chancellor, for that clarity there and that solid answer. I'm going to bring in Dr. Stevens. You have experience. You've been a former grade school teacher, a pediatrician. How do you get your kids to wear a mask? Do you have any tips for parents, caregivers, as to what they should be doing to start to socialize mask wearing and get kids accustomed to it?
So I think there's a spectrum of ideas and tactics, and much like the Chancellor, I kind of want to give my context, my disclaimer, right? There is wide variability in our kids. That's what's beautiful and wonderful about them, and it takes different things. It can also depend on age. I agree with the Chancellor in absolutely 100% terms, in terms of, we don't want to start in an enforcement framework, right? We want to educate, we want to expose, we want to engage. So for some kids, it may be understanding the why. And for, particularly our younger kids, it might be by example, right? And for other kids, it might really be in modeling, right? Doing things that they enjoy and are used to with wearing a mask, right? And so if school isn't something that they're used to, and that is the first thing they do with wearing a mask, you may want to think about more routine things that they do and engaging in mask wearing in those things. It's desensitizing, right? At the same time, there are games, there are songs, there are puzzles, right? I have seen some of the cutest things I've seen in masks. There's like a Winnie the Pooh mask I saw in a store the other day. I bought it for my nephew. But I think in the end, you can also ask, please, right? Different strokes for different folks, and it might take one or several techniques. But as the Chancellor said, you want to try everything to bring people to a place of understanding, because in standing in that, then people can kind of participate and feel engaged in it. Even our young people, big fan and advocate for youth voice. And you might have to trick them, right? Wear your mask, right? And we could go to the park. I'm just putting it all on the table. But many techniques might be necessary.
Thank you. I certainly appreciate the trick 'em. I feel like I use that one with my 8-year-old all the time. A little carrot always goes a long way. Want to get back into questions. We've got a question from Margaret Whitehead. She wants to know about our registered nurses. How many schools have been assigned a registered nurse? Where are they coming from? And how will they be fingerprinted on time? And Chris, I think, Chancellor and Chris, I leave that to you two to answer.
Sure. Thank you, Adrian. So, the million-dollar question of the day, so when we left in March, we had 359 buildings that did not have a nurse assigned, and for multiple reasons. Many of them aren't required by the state due to enrollment, due to lack of a student having a medical need or a medicine administration need. But needless to say, thanks to the Chancellor and his work with the mayor, we've had a commitment and a partnership that developed a couple of weeks ago with health and hospitals. They've been super successful over the last 6 months in finding agency nurses throughout the country, and more importantly, right here in the city, to work at our hospitals and to work at programs to assist with the pandemic, and have really been at the forefront of why the infection rates are what they are today, and why New York has been really the model state across the country. So the partnership with them was developed. We've identified the need of 359 sites. We also recognize that due to illness and sickness and leaves and other things, we're anticipating that absences might be higher than usual with our nurses. So we've sent them a list of 420 sites, and we've asked them to assist us with banning those sites. I'm happy to report that we've been receiving lots of work internally through our Division of Operations and with our Chief Operating Officer, Selena Ramirez. So we've been expediting fingerprinting daily. We've identified 600 nurses, 383 have been interviewed, 150 have cleared fingerprints, and we're moving daily towards reaching this goal, which by September 8th, we need to ensure that there's a nurse in every building in New York City. So that's kind of where we are today. Those nurses are also being trained as they're being hired. We're encouraging them to start when staff come back on the 8th, and we're excited at the new agreement that allows for nurses as well to join with the teachers to get extra professional development as we ramp up for reopening on the 21st with students.
Thank you so much for that, Chris. Our next question comes from Chastity Ruiz from Bronx School of Law and Finance, and she has a question about the flu season. And her question is, with the flu season coming up, how safe are students during blended learning? So if you could talk a little bit about how you're thinking about the flu and how we're controlling for that as we approach the fall.
Absolutely. I'll start. This is going to be a joint and a team effort for us all. Under normal circumstances, flu is actually a big deal. I'm a pediatrician, right? We care. It shows up, it matters. This year particularly, there's a word we use called sendemic, but it just means at the same time, right? That's what that means, right? And so we're particularly interested because, as you mentioned, a kid with a cough and a fever, come flu season, that could be flu, that could be COVID, there could be many, many things. And so one of the important things about flu season every year is protecting our kids, our families, and our school community against undue disease burden. But this year particularly, it will be important for us to protect our communities and ourselves and our students from illness as much as possible. Now, what I will say is when you look at our core 4 public health principles, wearing a mask, washing your hands, physical distancing, staying home when you're not well, those are actually effective against influenza. You know, it's impossible to predict the future, but based on some modeling that we've seen for places, foreign countries and certain populations who have had flu this year, they have noted that they have had greater success with the flu, lower rates of transmission of the flu, partly because of measures and public health measures that were in place for COVID. I hope that holds. It is a part of our planning. It is my deep belief and hope as a pediatrician that we are able to come together and continue our best practices, but we need to be ready, and a good vaccination is part of that. And again, knowledge is power. There are a lot of stories about the flu vaccine. There are a lot of stories about who can get it, who can't get it. Again, stay up to date with the best information, and that can take us halfway there.
Very good. Thank you very much for that answer. Our next question comes from Bushra Aslam from PS22. And the question is, I would like to know what you will do when it's cold about opening the windows. And Chancellor, I think that's a question for you. And we have Sal on the line from DSF also. And maybe even the doctor wants to jump in on this one. What are we going to do with the open windows as we move into winter?
So look, I'm going to start, and then I'm going to pass it off to my colleague. This is not business as usual, and we often think about close the windows and preserve the heat, and it's an efficiency. Efficiency does not matter. What matters in this particular situation is that we have the airflow that's appropriate, and that we have the safety of our students and staff first and foremost. So if that means that we have to open the windows to have airflow, even when it's cold outside, and that means that the heaters have to work harder, we're going to do that. Bar none. The safety and health of our students are first and foremost. So I'm just saying, I will rob Peter to pay Paul to pay for that energy bill to make sure that our kids are safe. With that, I'd like to invite, my colleagues that are experts in this to talk about what is the plan.
Thank you, Chancellor. This is Sal Calderon. So you pretty much hit the nail right on the head. The objective right now is not so much about energy efficiency, but more about ensuring the health and safety of all of the building occupants, students, staff, visitors, parents, whoever. So with that said, our plan is to keep our windows open when we have to. But in addition to that, what we are also doing is we are, having our filter systems upgraded. We expect our systems to be operational before the colder weather gets in, and that will allow us to get a little bit of both worlds. We'll be able to run more efficiently, and we'll also be able to make sure that the air is being ventilated and properly filtered.
Thank you very much for that. Thank you, Al. Thank you, Chancellor. Our next question is from one of our teachers, Nancy Lugo, and she wants to know, and I think part of this is a Chancellor question, part of it is a Dr. Stevens question. How is the DOE working with parents and teachers who are at risk to protect them from getting COVID? So Chancellor, I know you have a lot to say about protecting teachers and the accommodations process, but I think it would be great to hear Dr. Stevens talk about what can parents who have underlying conditions, how should they be thinking about school reopening?
So Dr. Stevens, if you don't mind, I'll start and then I'll pass it over to you if that's okay. Look, I've lost 8 family members to COVID. I understand underlying conditions. I understand that people are scared. I feel it. I've lived it. This is not for me an esoteric exercise in strategic planning. I'm living this. So I get that. But that's why we've provided the opportunity for teachers to request accommodations. We're honoring those accommodations. That's why we're making sure that our health and safety protocols are stricter than anywhere else in the nation around what this will look like when we do come into in-person learning, and making sure that we are very clear about what will happen if there is a case, because there will be a case. I mean, this is a pandemic. With that being said, we are depending and we are working with and we are relying on our partners, and Dr. Stevens is a great example of this, our health professionals, our physicians, our epidemiologists that are guiding us in terms of setting a bar that is so high that we will not risk any students or staff members becoming chronically ill with this virus. So with that said, those are our guiding principles, and that's how we're leading in terms of how we go forward. Dr. Stevens, what would you like to add?
I very much appreciate how you frame that. I think that is right for our guiding principles. I think the only thing I would add in operationalizing those principles, if you're a parent, if you're a teacher, if you're staff, if you're thinking about how do I prepare myself, how do I, before, there's any exposure, it is public health principles. It is paying attention to your care. We talked about the importance of not delaying care, right? People were afraid of hospitals. People were afraid to go outside for a while, but it is really important to stay on top of your preventive health. It is important to apply for accommodations. It is important to make sure that you are supporting well-being, because if you are stressed out and tired and have no more gas in your tank, you are at more risk of becoming sick for any other reasons. It's hard to be vigilant. It's hard to be careful. It's hard to be a part of a community. So it's holistic approaches before, right? It is for those folks who are back at work and engaged, those public health principles, making sure you're washing your hands and staying socially distant, right? And should someone become ill, it is accessing care, right? I'm not saying that medical school was the most fun time in my life, but I was working and I was learning, right? It wasn't as hard as the first year in the classroom. I will say that was hard. That was hard, right? But that's what our professionals are here to do, is to take care of folks. And so hopefully it doesn't get to that point. Again, I'm talking about operationalizing the principles that the chancellor has set out, but we are here to take care of everyone, our school community and our entire city. So please don't put it off. Please take your health very seriously. Put yourself and your family first. And really, we're here to partner to help everyone kind of get through this. That's the only thing I have to add.
Thank you very much. We have a question from Amba Stewart from Brooklyn Technical High School, and she wants to know, will the classrooms be wiped down after each class? Which I think just begs the question of what's going to be the cleaning and sanitation process for our schools. So Chancellor, I don't know if you want to kick that question off.
Yeah, I'll start, and then I'll ask my colleagues to chime in. So listen, I've seen demonstrations now of the electrostatic disinfectant. And it's got positive ions, which means it clings to the surfaces and it protects the surface and it kills the virus for 24 hours. So that's the extent of my technical knowledge. But I will say to you that there will be a consistent 24-hour a day wiping down and disinfecting all high-touch areas like handrails, doorknobs, faucets, etc. In addition to that, at the end of the day, there will be this electrostatic cleaning, which will prepare the building for the next day. Now, one of the questions that I've gotten is, why isn't it possible, instead of having, 3 days in person, 2 days remote, why can't we just do 2 shifts, the morning shift and the evening shift? Well, the reason we can't do that is because it doesn't give us enough time to do the deep cleaning and the electrostatic disinfecting that we need to do for the entire facility to be ready for the next shift. So again, even that decision, which in many cases may seem like a no-brainer, like why don't you just do that? It's because the medical science tells us we don't have enough time to prepare the building for the next day of learning and keep it safe and disinfected. So again, it's going to be 24/7, that along with the wearing of face masks, and I can't emphasize this enough. And I want to thank my fellow New Yorkers, where there are communities and states across this country that have politicized the wearing of face masks. We in New York have said, it's not politics, it's about science. So we're wearing our face masks, we're washing our hands, we're staying in, we're socially distancing. That has allowed us to be the only one of the 10 largest school systems in America to have the underlying conditions to be such that we can even consider in-person learning. And that's based on the science as well. So we're going to continue to walk down that path. We're going to continue to be very clear about what those protocols are. And, and I have to just say, some of the things I've said tonight, people may say, oh man, the chancellor's being really hardcore about these things. You don't wear a face mask, you're going to remote learning. You don't want to get tested, you're going to remote learning. I don't apologize for that, because it is exactly those practices that have allowed us to be able to be in a position to be the envy of the country. Whereas in March, we were the epicenter of the epicenter. So this is something that New Yorkers should be very proud of. We've done this. And it breaks my heart to understand that we have children that have undergone so much trauma that need to have in-person services. And we are now in a position to be able to do that because of the hard work that New Yorkers have done. So with that, I'm just going to pass it on because I know I've gone beyond the question, but I think you can sense my passion coming out about why this is important for us.
Thank you so much, Chancellor. And actually, we're coming to time. And so before we close out, I do want to give Dr. Stevens an opportunity to say some parting words to us. And then, of course, as always, we will end with our closing by our Chancellor. So Dr. Stevens, what do families need to know? What are your parting words for our families before reopening?
I think the Chancellor really framed this. New Yorkers saw how bad it could be and rose to that occasion. And we have really done what we needed to do. It hasn't been easy, it hasn't been pretty, but we've done this. And I want to stand in that and be proud to say, we're here to partner with you, to guide you, to support you, to continue that success. Please, stay grounded in the science, stay informed, support one another. Nobody is getting through this alone. But really, families, continue to do what it is that you do, which is to support your kids. And this is a huge undertaking, but it's worth it. So thank you. And the last thing I say to families, I'm sorry, I should have put that first. Thank you to the families. Okay.
And thank you to you. And thank you also to Chris and Sal for joining us tonight. And with that, Chancellor, can you close us out for the evening?
So Deputy Chancellor Austin, thank you and your team for making this possible. I want to thank Dr. Stevens. By the way, I've got a 4th grade teaching position anytime you want. And it's good to have an educator that's also a physician. But I also want to say this, look, we have no vested interest except that we want to make sure that our children, our staff, our community is being served in the best possible way. We wouldn't even be having this conversation if today we didn't have a positive transmission rate in New York City of 0.07%, which means that less than 1% of our New York City residents are even testing positive for COVID. Other places in the country, and I know people watch the news and you're seeing how school systems open and then they close. They should have never opened in the first place because their transmission rates were too high. And we've set a very, very conservative bar because health and safety is first and foremost for our students. But I've also sat with parents who have said to me, my child is in distress. My special needs child has regressed in their progress. My children are in trauma. I'm not working and I can't find a job until I know that my child can have some semblance of an in-person learning experience. And I don't know about anybody else, but I will tell you, in my 32 years as an educator, I went into education to serve our children. So when our parents are overwhelmingly telling us we need this, we are in a position because of what we've done as New Yorkers to give us the opportunity to do this. We're going to make sure that we're safe, we're secure, and we're going to be we've been very clear about what will we do if that infection rate goes beyond or gets to 3%. We're going to close the system. We're going to go completely to remote learning. But we've also been very clear that our children need us. Our community needs us. So we're going to continue to make sure that we have all of our systems and protocols in place to make sure that our students, our staff, and our communities are safe, they're secure, but we're going to rely on the science, not the science fiction. And that's going to be our mantra as we go forward for September 21st. So with that, Deputy Chancellor Austin, Dr. Stevens, and everybody else, all of my colleagues that have joined us, Chris, thank you, everybody. Thank you for being on this call. We are here to serve. Somos, in my first language, because I'm an English language learner, I'm going to say, estamos aquí para servir, which means we're here to serve.